Okay, so the final one I'm going to show you for my range of exercises that I'm basically sticking with. As I say, there's only 5 or 6 exercises that I need to be doing, and over time you can reduce them down to say 3 or 4, probably the going back the way. So this would be the most beneficial one. The one previous would be the next most beneficial, and then going back the way. So if you think about the very first one we did with the foot pumps, okay, that is more about circulation. That's in readiness for your exam, for your operation, and post-operation, immediately post-operation, just to keep that DVT at bay, should there be any risk there. So this, for me, this is the one that I'm going to spend a lot more time on now, and I've adopted it slightly. And basically this is where we draw the knee up, and they're basically just knee bends. So we're drawing, sit as far back on the chair as you possibly can, and we're drawing the leg up to make a knee bend. And what we're actually looking for, this angle here, we're looking for a 90-degree angle. Now, 90-degree angle for me is going to be here somewhere. So you can see I've got a heck of a lot of way to go just yet. I can't quite get to the 90-degree. Again, the reason I can't get to 90-degree is because the pull across the back of here is still, remember, we've cut all the way through these muscles, and these muscles have been stitched up. We've also got a lot of repair going on to this cut area, incision area. There's staples in here. This is due to come off on the 2nd of September, which is 14 days post-op. Again, this is one where you've just basically got to bear with it and try your damned hardest to work through the pain. This is not an easy exercise to do. Right now, I'll give you an idea of the pain. No pain, no gain, as they say. So at the moment, in that position, I've just got a dull aching pain. That dull aching pain's there all the time. As I pull the foot towards me, I get tightness across here, and I start to get pains going down here and down this side as well. Nothing in the lower leg, it's all here for me. I'm not saying that's the same for everybody, but certainly for me, that's where it is. Okay, if it helps, you can put this leg, your good leg, across the front of your post-op leg, and you can pull your leg towards you. It just helps you to try and get through that pain barrier. Pain, no pain, pain, no pain. The more you can push that back, the quicker this recovers, or the quicker the muscle repairs itself. Okay, so that's a good one to do. The other thing I do whilst I'm doing the crossword and reading the paper and having a brew, I put my foot against the leg of the chair or leg of the table, and I move forward a touch and just keep rocking backwards and forwards. And all I'm doing here is I'm just increasing and releasing tension on these muscles. Just rock back and forwards, back and forwards, back and forwards. And it's just getting this muscle, if you like, it's educating the muscle to do what it's meant to do. At the moment, it's a sack of tissue, if you like, that has not got a purpose. It's had a big cut through it to get to the knee and everything else. The surface feel here, this area at the moment feels as though I've been to the dentist and I've still got some lignocaine in my gum. I can't feel that. I'm touching, I can't feel it. In some places I can feel like pins and needles. Same on this side, but not as bad. I can feel a lot more on this side. But that, don't worry about that, that's not an issue. So long as you rock backwards and forwards, every now and again, release the foot down, allow the foot to go away from you. Stretch the leg if you need to, put your hand on, push it down, just to stretch that back of that leg here, back of the knee, just stretch it down, bring it back up against the table leg and push. Okay, again, do some of this. You can vary it. Okay, again, you're looking at 10 to 20 times doing this. The longer you can do it, I've sat here over the last few days since I got out of hospital, I've sat here for a good half hour, 45 minutes, just backwards and forwards, alternating between the rocking movements and the stretching movements. And it's basically going through the whole range to get this muscle to understand what its purpose in life is. The brain will educate the muscle, and again the muscle will start working again the way it should do. So that more or less concludes the exercises that I'm going to show you. They're the ones that I've got anyway. So I'll just do a very short video just to finish that off, and I shall leave you with it, and let me know how you go on, please.